name is Amanda Longan, and Sean Longan has given permission to be videoed for the purpose of the comprehensive physical assessment.
Come in.
Hello, are you Terry Sean Longan?
Yes, ma'am.
Can you confirm your name and date of birth for me?
Terry Sean Longan, 7/15/1976.
Awesome, that is what I have here. My name's Amanda, and I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment on you. That's just where I check everything over and kind of get a baseline for us to take care of you. Is that going to be okay?
Yes, ma'am.
Okay, I'm going to wash my hands, and then we'll pull your curtains, and we'll get started, okay? Wash my hands. How are you doing today?
Well, how about yourself?
I'm doing pretty good. It's a beautiful day outside. Right, curtains. Okay, can you tell me today's date?
July 18th, 2023.
Okay, and do you know what town we are in?
Homeowner.
And who is the president?
Joe Biden.
Perfect. Can I get some vital signs on you?
Yes, ma'am.
We're gonna start with your temperature. And while that's going, I'm gonna go ahead and get your blood pressure and stuff, okay? Put this here. Just slide this under your tongue and hold it there until it beeps. Wrap this around your arm. Pulse. (118/68). Great blood pressure, okay. 97.9 is your temperature. Do you take anything for blood pressure?
No, ma'am.
Great. Okay, write this down. Now I'm gonna get your pulse. Here. Okay, got 80 for pulse and 14 for respirations. They were even and unlabored. And now I'm gonna check your oxygen. Are you in any pain?
Just a slight pain on my left knee.
On your left knee? Okay, on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain you've ever felt, what would you say it is?
3.
3, is it aching, sharp, throbbing,
Kind of a dull.
radiating? Okay, a dull ache. Is that constant?
Depends on what I did the day before.
Okay. Do you take any medication for it?
Just over the counter ibuprofen.
Okay.
When I need it.
Does that alleviate the pain?
Yes, ma'am.
Oxygen is great at 99%. Fantastic. Okay, I'm gonna take a look at your eyes, nose, ears, and mouth, if that's okay.
Yes, ma'am.
So if you could, I just want you to look right here over my shoulder. I'm gonna cover your eye so that it works better in dim light, and I'm gonna shine this light to your pupils. Very good. Move here. Very good. Both eyes are equal and accommodating to light. Perla. Gonna look in your ears. No obstruction, bleeding, or drainage. And look over here. No obstruction, bleeding, or drainage. Do you have a headache?
No, ma'am.
Any dizziness? Can I look behind your head to make sure there's no wounds or lesions? Very good. No evidence of any lice or anything like that. Just gonna shine the light up your nose, okay? Nares are patent, no sign of deviation, no lesions. Can you open your mouth for me? Do you have dentures? Okay, keep it open, there we go. You say ah, no lesions, mucous membranes are moist, pink, and intact. Very good. Do you wear glasses all of the time?
Yes, ma'am.
Okay, can you read my name tag right here?
Longan.
Very good. Any dizziness or blurry when you looked at that? Okay. I'm just gonna feel right here and then kind of move out to the side. Is that okay? So right here. Trachea is midline, no deviation. No swollen lymph nodes. Swollen lymph nodes here. No evidence of JVD. Very good. I'm going to go ahead and check skin turgor. No signs of dehydration. Very good. And cap refill. Less than 2 seconds. Very good. Okay, I'm going to go ahead and listen to your lungs and your heart, if that's okay. For your lungs, I'm going to be listening, going back and forth on your sides and in your back. Every time my stethoscope moves, can you take a deep breath for me?
Yes, ma'am.
Good. I'm going to move to your side. Very good. Can you sit up for me? Good. Any shortness of breath? Going to move back and forth here. Very good. Respiration's even, unlabored. Chest expansion is equal. No retractions. You can lean back for me. Do you have any shortness of breath?
No, ma'am.
I didn't notice a cough. Have you been having a cough at all?
No.
Okay, very good. Next, I'm going to listen to your heart. Have you had any chest pain?
No.
Do you wear oxygen normally?
No.
Okay, if he did, I would compare his oxygen rate to what is ordered. If he was on a ventilator, I would check the mode, the setting, the PEEP, the FiO2, make sure all of that matches what is ordered and that everything is connected with no alarms going off. Go ahead and listen to your heart. I'm gonna listen and feel at the same time, make sure that what I hear is what I'm feeling. Move down, take the apical pulse for 60 seconds. S1 and S2 is auscultated with no evidence of S3, no heart murmurs, no gallops. Do you have a history of any heart disease or anything? Okay, can I look at your feet to check for edema?
Yes, ma'am.
And I'll check the capillary refill on your toes too. Make sure he's covered, only exposing what I need to. Okay, checking cap refill, less than 2 seconds. No edema, no pitting edema. Check all the way up to the knees. I'm gonna go ahead and check pedal pulses while I'm here. Both pedal pulses are palpable and strong. Okay, while I'm here, I'm gonna go ahead and check the strength in your legs. Can you push on my hands like a brake pedal? Very good, very good. Any pain when you do that? Okay, lift your leg to my arm. Very good. Right here. Very good. Any pain?
No.
And this is the leg that's hurting?
Yes.
Okay, can I have you bend it? Any pain when you do that? Okay, very good. Range of motion normal. I'm gonna go ahead and do it over here. Very, very good. Okay. Again, no chest pain, shortness of breath, or anything like that. Very, very good. Okay, skin is warm and dry. No evidence of pallor or cyanosis. No cyanosis around his mouth. No cyanosis in the finger beds. Next, I'm gonna move to your abdomen. Is that okay?
Yes, ma'am.
Go ahead and wash my hands again. When I'm assessing the lungs and the heart, I would check all central lines, all chest tubes, make sure that they are patent, draining like they should be, that they're connected, that there isn't bubbling. Okay, now I'm going to assess your abdomen. Is that okay?
Yes.
I'm gonna lift up your shirt. All right, very good. No evidence of distension. Now I'm gonna listen to it. I'm gonna listen in all 4 quadrants at least 5 seconds. Very good. Bowel sounds are active, not hypo or hyper. When was your last bowel movement?
Today.
Today. Tell me if any of this hurts when I'm palpating, okay? Was it normal?
Yes.
No pain, hemorrhoids, bleeding? Any differentiation in color? Okay. No pain when I did that? No evidence of distension, not obtunded. Okay, what about your urine output?
It's normal.
Normal. How many times a day do you go?
3 to 5.
3 to 5 is, what color is it?
It's clear.
Any abnormal smells?
Nope.
Any pain when you urinate?
No.
No blood?
No.
Any sediment? Very good. Normally I would assess the genitals, but we are deferring that for the purpose of the video. And what's your diet like? Like, what kind of food do you eat? Do you eat
Just
whatever you
water.
want? Whatever you want. Make sure that you keep a well-balanced diet that is high in fiber to keep your bowels regular. He doesn't have a gastric tube, but if he did, I would check the patency, make sure that it's flushing, make sure there's no drainage around it, change the dressing if I need to. Before I give medication, I would check placement, make sure there was an x-ray intact or in place, that placement was verified. Make sure I check the suction setting. If he had a Foley catheter, I would make sure it's draining the gravity right here, that it was patent, there wasn't any pain with the Foley catheter. And can I take a look at your IV?
Yes.
Right. Perfect. Any pain? No redness, no swelling, no sign of, okay, very good. No sign of allergic reaction. And his IV medication matches his orders. If he was on a CPAP, I would make sure those orders matched as well. If he had any wounds, I would measure them, change the dressing, check the orders, document the drainage, and then I would check for restraints, make sure that all other avenues were used prior to restraints, and then that if I had an order for restraints, that they were put on, checked every 15 minutes, check the circulation, make sure that there was no pain or distress in the patient. Do you have any questions? Okay, I'm gonna give you your call light. Make sure that you call us for help. You are a fall risk, and so you need to always call us for help when you need anything. Go to the bathroom. I'm gonna put your bed in the lowest position. There's also a call light right here. Drink plenty of water. Follow your doctor's discretion when it comes to your knee pain. Only take the ibuprofen as ordered. You can use rest, ice compression, and elevation to alleviate some of that pain. And if it starts hurting, quit using it. And also follow doctor's orders when it comes to follow up on x-ray, MRI. If they give you a referral to orthopedics, follow up with that. Okay? Any questions?
Amen.
Thank you so much for letting me do the assessment on you today. Here's your call light and your water. I'm gonna pick up my mess and I will see you next time. Thank you very much.
Thank you.